So you have 6 bills before us, Senator Hernandez.
I'd be more than happy to go in order.
That'd be perfect. So your first item would be Senate Bill 586.
Thank you, Mr. Chair and members. This bill, SB 586, responds to the administration's call to create a whole child model for the California Children's Services Program. Under the whole child model, Medi-Cal managed care plans in counties served by county organized health systems would receive all of their services through the plan. Under current law, CCS services are carved out of the plan and reimbursed in what we would call a fee-for-service. The CCS carve-out ends at the end of this year. The administration has stated that they will not continue to extend the carve-out without having children receive their CCS services through an organized delivery system. We've had several meetings with the department and advocates on the bill and hope to come to some resolution, hopefully over the summer. I'm accepting the suggested amendments on comment 7 in the committee analysis, and the sergeants are distributing a mock-up, and I appreciate the staff's involvement in the issue. And with that, members, I do respectfully ask for an aye vote. I have individuals here who would like to speak on behalf of the measure.
Thank you.
Hi, I'm Kelly Hardy with Children Now in support of the bill. You don't want to hear from me about this bill. You want to hear from the experts. And so I have J.C. Aguirre here from Merced, and he's a CCS consumer, and Wendy Longwell, a parent from Reading. And J.C. will go first.
Great, thank you.
Good afternoon. I just want to say to all you, I'm grateful to have the opportunity to speak here today. It was a very exciting experience. So I'm just going to give a little background on who I am. So I'm 13 years old, and I was born blind and deaf on my left side with malformed vertebrae in my neck. I've had 18 surgeries, and I became a CCS client at birth. My experiences with Medi-Cal make me very concerned about the CCS transition. I've had 7 primary care doctors in 7 years, and that's a kind of a sad figure. Changing providers can be dangerous, and I discovered this a couple of years ago when I fell and had pelvic pain and difficulty urinating. I saw a primary care doctor I didn't know who gave me a urine test and a prescription and sent me home. I ended up in the emergency room because I couldn't walk. If the doctor understood my complex conditions, he would have recognized my symptoms as neurological. Seeing the same providers is essential because my birth defects are not going to go away. The CCS program allows me to be independent and enjoy every moment of my life. With Medi-Cal, to see my specialist, I must see my primary care doctor for referral and wait for authorization. By the time the paperwork is done, I could be paralyzed or dead, and that is extremely scary for someone who lives with that constant fear every day of his life. My CCS caseworker, Anita, knows what I need and makes sure I have access to specialists right away. I don't see how Medi-Cal can maintain the same level of care considering the shortage of in-network specialists. Repeatedly changing specialists will endanger my life. The safeguards in Senate Bill 586 ensure continuity of care for the length of the condition and maintain the high CCS standards. These protections must be included to adequately care for children like me. Without these protections, many children could suffer needlessly. I strongly urge you to pass this bill. Thank you.
Thank you.
Hi, my name's Wendy Longwell. My son Derek has been with CCS his whole life. He has spina bifida, and in April he had his 43rd surgery. And I wanted to, I sit on several committees working on this bill and the different changes that need to be made to it. And I support the bill in a whole, but there's different things that we keep getting told that CCS standards are not going to change. What us as parents are used to dealing with are not going to change. But as I read through this, I'm not seeing the language that guarantees me that. And probably the main thing, my son had surgery, his 43rd surgery in April, and he just recently turned 21. So I just went through this transition that is going to be happening to everybody else. So this was one transition happening at a time, and it was the most rocky transition I have ever experienced. So what's going to happen when there's hundreds of kids transitioning at once. And the number one thing that I could say is I met with the Medi-Cal managed agency 4 days before my son turned 21, and they still did not have his records from the state, when we've been told they're supposed to get them 30 days before the transition. So if they aren't getting them now, what's going to happen when hundreds are coming all at once? The managed Medi-Cal agencies need these at least 6 months ahead of time so they can review them and be prepared to take on these fragile children. And that is not happening at this time. And caseworkers, they can decide if they're going to keep the CCS caseworkers or not. So when you call your managed Medi-Cal agency, you get a different person each time to talk to about your child's care. And just like what KC was saying with your doctor, same thing. Do you really want to explain 43 surgeries? Do you really want to explain the complex issues to somebody that knows nothing? No, I want a caseworker, which is what I have with CCS, and that's what I want it to continue. And so there's definitely some issues that we need to make sure get resolved so the safety of these children are guaranteed when we do this transition. Thank you.
Great. Thank you very much. Others in support, just your name and organization, please.
Michelle Cabrera with SEIU California in support. We have members here who are both CCS public health nurses as well as IHSS recipients workers whose children are in the CCS program, and we urge your support of this measure.
Thank you.
Okay, I'll speak on behalf of her. This is my daughter, Serenity Chavez. I am Antonia Chavez. I am here on behalf of the SI 15, and I support Truly Really Strong, the 586.
Thank you very much.
Jim Casares, public health nurse in Riverside County, in support.
Thank you.
My name is Danielle Kelly. I'm a public health nurse with CCS in Riverside County, and I am in support.
Great. Thank you.
Mi nombre es María Núñez, vengo del condado de San Bernardino y estoy en apoyo de la propuesta 586. Gracias.
Thank you.
I'm Barbara Anderson, public health nurse, LA County CCS,
Great.
and I'm in support.
Thank you.
Eleanor Volheim, public health nurse, LA County CCS, and also with SCIU.
Great. Thank you.
Cherie Trumbull, I'm with Los Angeles CCS. I'm a member of SEIU 721.
Thank you.
Hi, my name is Vanessa Garcia, Senior Public Health Nurse at CCS, and I'm in support of the State Assembly bill, and I'm also with SEIU.
Great. Thank you.
Judy Darnell, in support for the United Ways of California.
Great. Thank you.
Kathy Dressler with the Children's Partnership and strong support.
Great. Thanks.
Mira Morton here on behalf of the California Children's Hospital Association, also in strong support. Thank you.
Thank you.
Jenna Jensen with Chalk Children's Pediatric Health System in Orange County in strong support. Thanks.
Thank you.
Jerry Jeffy, representing the California Chronic Care Coalition, in support.
Thank you.
Linda Way with Western Center on Law and Poverty in support.
Thank you.
Trent Smith on behalf of the county organized health systems identified in the bill in support of the concept of and look forward to working with the author and the stakeholders on a final product.
Thank you.
Justin Garrett with the March of Dimes in support.
Thank you.
Terry Calgar Hill on behalf of Children's Hospital Oakland, as well as the Hemophilia Council of California, in strong support.
Thank you.
Margaret Johnson with Disability Rights California. We support if amended and look forward to continued working with the stakeholders to address any amendments that we think are needed. Thank you.
Thank you.
Kristen Hare with your Arthritis Foundation in support.
Thank you.
Sarah Linder, National Association of Social Workers, California chapter, in support.
Thank you.
Angela Blanchard on behalf of the Children's Specialty Care Coalition, representing nearly 2,000 pediatric subspecialists who take care of these very important kids, in support.
Thank you.
Ilana Ford, parent of child who sees over 15 CCS paneled specialists, in support.
Thank you.
Lori Butterworth, Jacob's Heart Children's Cancer Support Services, in support.
Great. Thank you.
Michelle Stoll-Parvensky, Children's Defense Fund, California, in support.
Thank you.
Hello, I'm Danielle Kenworthy, parent of a child 21 years old who is benefited by CCS. I'm speaking in support of this bill.
Great, thank you.
Bill Remack, California Hepatitis C Task Force, in support.
Okay, thank you.
Jim Gross on behalf of the Cystic Fibrosis Foundation, in support.
Great, thank you.
Lydia Bourne, California Division, American Academy of Pediatrics, in support.
Thank you.
Barbara Glazer with the California Hospital Association, in support.
Thank you.
Rain Hicks, California Disability Rights, in strong support.
Great, thank you very much. Anyone else in support? Seeing no one, anyone in opposition? Please come on up.
Good afternoon, Jennifer Alley with California Association of Health Plans, and we're not opposed to this bill. We just have some technical concerns with some of the processes outlined, and we'll continue our conversations with the sponsors. Thank you.
Great, thank you. Anyone else?
Mr. Chair and members, Rick Rollins representing ARCA, Association of Regional Center Agencies. We as well do not have a position on the bill. We look forward to working with the author about a couple of issues that we have concerning application in the regional center system. Thank you.
Thank you. So anyone else in opposition or in between? Okay. Questions from the dais? Any members have any questions? Comments? So we have some amendments. Are you accepting the amendments?
Yes, I believe I stated that, yes.
I'm sorry, I didn't catch it.
No problem.
Okay.
Yes, willing to take the amendments.
Thank you. Lacking a quorum, I'd like to give you an opportunity to close, if you'd like.
Yeah, thank you, Mr. Chair and members. As you can see, we have a very vulnerable population of children that need services, and I think this young man to my left here so eloquently said that we need to make sure that there's a continuity of care and that this care continues on, whether we do from a fee-for-service or into managed care program. Understanding that, yes, we have expenses that we have to control, but we have to make sure that these patients are taken care of. And with that, when appropriate, I'd appreciate an aye vote.
Great, thank you.
Thank you.
Madam Ms. Olson.
Thank you, Mr. Chair. I just wanted to compliment you in your testimony. You are probably the most poised, confident 13-year-old I have ever seen address the legislature. Well done.
Thank you.
So I guess the question I would have, is he that polite at home? Or I think his mom may differ a little bit. Is that true? But he did a great job. Thanks.
Absolutely. Thank you for being here to testify. Most impressed. If you're at age 13, I shudder to think what you will be like in 10 years. Thank you, Senator Hernandez, for bringing this forward, this critical bill that sets the framework for the future of the CCS program. The bill moves CCS beneficiaries into our counties managed care. I'll note that this includes the entirety of the district I represent. So for this reason, it's important to me personally that the bill passed out of this committee in as strong as possible for CCS children and their families by ensuring that CCS beneficiaries continue to have access to high-quality healthcare services, providers, and medical equipment. These are critical services they need not only to stay alive, but to maintain a high quality of life. Thank you for bringing this a strong bill forward as a starting point for negotiations and accepting our amendments. I look forward to continuing to stand with you as we negotiate with DHCS, and with your permission, I'd like to be added as a co-author.
By all means, yes.
Thank you very much.
I appreciate it. It's an honor.
Moving on to your next bill.
I believe it's 908, Mr. Chair.
Yes, thank you.
Is that correct? 908?
Yes, I'm sorry. Okay. Thank you.
Yes, and we will be adopting the amendments in the committee analysis. So under existing law, rate increases for individual or small group health insurance must be filed with the Department of Managed Health Care or the Department of Insurance. Department actuaries perform an in-depth reviews of all proposed rate increases to ensure that the proposed rate changes are supported by underlying medical costs and course trends. In this process, departments have been successful in negotiating down many rates. Consumers and small businesses owners have saved more than $417 million because of the rate review system. Since rate review began, 6 companies have moved forward with unreasonable rates at least 26 times, which is impacting over 1 million individuals that we have in the state. The consumers and the small business owners who have purchased these products only know about the unreasonable rates if they look at the website or departments or the companies. departments have taken into issue press releases in efforts to notify the public. This bill requires a health plan or insurer whose rates have been determined unreasonable to share that information with the purchasers on that policy product so that the purchaser can have the information when they are shopping for coverage. I have amended the bill several times to respond to the plan's concerns. With the amendments proposed today, the bill now establishes a timeline for the rate submission and regulation decision so that the notices about unreasonable rates can be sent out with open enrollment. Members, I have individuals who like to speak in support, and when we have a quorum, I respectfully ask for an aye vote.
Thank you. Please go ahead.
Good morning. I'm afternoon.
Thank you. That's much better.
I'm Emily Resch. I'm the Executive Director of CalPERG, the California Public Interest Research Group, a statewide consumer organization. We supported the original bill, SB 1163, by Mark Leno to establish the rate review process. And over the past 5 years, I personally have reviewed dozens of health insurance rate proposals and written comments to either mostly to the Department of Insurance or the Department of Managed Healthcare with questions or comments about individual rate hikes. We recently completed analysis of the rate filings that have been presented over the past 5 years to the regulators. There are 565 different rate filings. Most of the reviews are completed without incidents. So I think it's important to note that most reviews are not, most rate proposals are not declared unreasonable. However, insurance companies have voluntarily withdrawn or reduced 69 rate hikes, or about 12% over the last 5 years. And at least 26 times, as Senator Hernandez said, insurers have moved forward with rate hikes that have been declared unreasonable by their regulator. In 2015, individuals and small businesses could have saved $46 million if the providers had actually taken the proposed amendments by regulators to make those rates reasonable. And as the senator also said, most consumers, if they have a rate plan that's been declared unreasonable, they don't know it unless they're actually going to the Department of Managed Healthcare's website or going to the Department of Insurance's website and looking for those press releases, sometimes which they don't even issue. That means that they won't know it. So we think this was a good bill to make the market work better, let consumers know, and give them the opportunity to shop around.
Thank you.
Beth Capel on behalf of Health Access California. We're pleased to be here as a sponsor and supporter of SB 908. As others have said, the only way for a consumer or a small business owner to know whether their rate is unreasonable is to look at a website that looks like this. I printed this out this morning. I defy any of us, much less an actual consumer or small business owner, to know whether their rate is unreasonable from looking at a website that provides this kind of information. What the bill does is simple. It gives notice to consumers and the owners of small businesses if the rate is unreasonable and gives them an opportunity to shop. Because of the amendments that are taken today, in most but not all instances, rate review will be completed prior to the notice going out. However, always happy to have a quorum, sir.
Please indulge me. Madam Secretary, please call the roll quickly.
Wood.
Here.
Mainshine. Bonilla. Burke. Campos. Chu. Gomez. Hernandez. Lackey. Nazarian. Olson. Patterson. Ridley Thomas. Rodriguez. Santiago. Steinnorth. McCarty. Waldron.
Thank you. Thank you. We have a quorum, and thank you, Ms. Capel, for indulging me. Please continue.
We were delighted to have a quorum as well, Mr. Chair.
Makes two of us.
To conclude, SB 908 would give consumers and small business owners notice that if their rate is unreasonable and give them the opportunity to shop. In most cases, the notice will come before open enrollment starts. If it does not, then a consumer will be given the opportunity to have a special enrollment period. So when they know that the rate is unreasonable, they have the opportunity to shop for a reasonable rate. Seems to us it's sort of the point of doing rate review. Thank you.
Thank you very much. Others in support, just your name and organization, please.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Thank you.
Ann Powell, AARP California Volunteers, strong support.
Thank you.
Elizabeth Landsberg, Western Center on Law and Poverty in support.
Thank you.
Michelle Cabrera with SEIU California in support.
Thank you.
Sarah Flox, California Labor Federation in support.
Great. Thank you.
Libby Sanchez, Laborers Local 777 and 792 in support.
Thank you.
Randy Hicks, California's Disability Rights and California Alliance for Retired Americans in strong support.
Thank you.
Autumn Ogden with the American Cancer Society Cancer Action Network, also in support.
Thank you.
Sarah Linner with the National Association of Social Workers, California chapter, in support.
Thank you.
Hi, Robert Copeland from Disability Organizing Group for National Total Equality in support.
Great. Thank you. Anyone else in support? Seeing no one, speakers in opposition, please come forward.
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans. We would like to thank the author and the sponsor for the meaningful dialogue that we have had over SB 908. And while the amendments are being taken today improve the bill in certain key areas, we are unfortunately unable to remove our opposition at this time. The health plans are not opposed to providing more information to consumers if it is meaningful, it can be implemented, and does not lead to market disruption at a time when our marketplace is still evolving. To that end, we did supply the author and the committee with amendments that reflect our position that the notice in this bill should dovetail or run concurrently with the existing rate renewal notice if the regulators make an unreasonable determination before the open enrollment period. In this way, the consumer can be noticed at the same time he or she receives the rate change letter at the annual open enrollment period. At that time, the consumer would be able to evaluate all the information together and make an informed decision whether to stay with their plan or switch to a new one. We think that a one-off letter might confuse someone into thinking that they must switch away from a plan that is currently meeting their needs. While the language being offered today does include new timelines intended to help this situation, it still would require plans to send a one-off notice and comply with special enrollment requests if the regulator did not meet the timeline in the amendments. We do not believe that the requirements in the bill should activate it if the determination by the regulator is made in the middle of open enrollment or after the new policy year has started, which in that case would be particularly disruptive. So from a fundamental perspective, our issue is predictability. Predictability helps health plans develop the most accurate rates. Allowing people through the special enrollment option in this bill to come in and out of the market outside of existing enrollment periods makes it harder to price products accurately. We have concerns around potential disruption there. We are happy to sit down with the author and sponsor again to continue the dialogue over this bill if it moves today, but we are opposed unless amended at this time. Thank you.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I'd align myself with my colleagues' comments. We too are opposed unless amended. We hope to continue the open dialogue with the author to work out an option that we believe will be user-friendly and consumer-friendly, but not add additional administrative burden on the plans to do so. Thank you.
Great. Thank you very much. Others in opposition?
Thank you, Mr. Chair and members. Teresa Stark with Kaiser Permanente. We're also in opposition, but I would echo the comments of my colleagues. We appreciate the author's discussions with us and the amendments that he has taken. We think there's more work to be done on the bill to ensure there are no unintended consequences for consumers, so we look forward to continuing those conversations. Thank you.
Great. And name and organization, please.
Yeah, John Winger on behalf of America's Health Insurance Plans and Anthem Blue Cross would also like to thank the author and the sponsors. Would echo the comments of Cap.
Thank you.
Dan Chick with HealthNet. We're in opposed unless amended position with concerns over the creation of the special enrollment period and some of the timeline concerns. Thank you.
Thank you.
Chair members, Luis Sanchez with Blue Shield of California in an opposed unless amended position, but looking forward to working with the author.
Great. Thank you very much. Back to anyone else in opposition? I'm sorry. Back to the committee. Any questions, Mr. Patterson?
Thank you. I need a little clarification. I'm a little unclear with respect to the notice. So why not notice the enrollee of the unreasonable finding at the beginning of the current enrollment period, so the enrollee can use that time to shop for alternative coverage if, in fact, alternative coverage is cheaper. It seems to me that there is a closeness here with respect to support and opposition, and I really hope we could get perhaps to this notice that comes at a time that does not confuse but also provides the opportunity for the person to go shop around at the time that they're noticed it's unreasonable.
Yeah, and I appreciate the question, and I think to address the comments of the opposition, unless amended, as before the open enrollment time, I believe we were trying to take language to address that, to get to that point, but maybe I can have the sponsors kind of maybe clarify your comment and question. But yes, by all means, I'm trying to make it as not onerous as possible, but at the same time, the consumer needs to know if something is found unreasonable so they have the option to look for another product if it's available. And if not, then they continue to stay with their current plan.
With your indulgence, Mr. Chair, Beth Capel for Health Access, the sponsor. The amendments today say that in all instances in the individual and small employer market, the rates will be submitted 120 days in advance of the start of the rate year. Under current law and under this bill, whether it's the individual consumer or the small employer, they get the notice of the rate increase 60 days in advance of the start of the rate year, which is prior to open enrollment. So in most instances, so it's that 120 days means that the rates are submitted, and in almost all instances, but not quite all, the rate review is completed within 60 days, so 60 plus 60, 120. So it's done prior to open enrollment as the plans wish, and we thought that made sense. It's part of the reason the bill was held over from last week to this week to try and do some amendments to sort that through. There are, however, instances in which rate review is not completed within 60 days. What the Department of Managed Healthcare tells us is that in some instances they believe the plan is not sufficiently responsive to their requests for information, and thus it drags on. In those instances, which are fairly few, fewer than 5% is our understanding, then because the consumer doesn't have that opportunity to shop that you were talking about, that period to prior to open enrollment when they can know whether the rate's unreasonable and shop, in those very few instances they are given a special enrollment period and given the opportunity to shop. What we want to see happen is, as much as possible, the notices come out at the same time every year. It's easier for everybody. So we're trying to move to that, and I think you're right. We're fairly close, but not quite there yet. So,
well, I'm trying to find a way to vote for you, Mr. Senator. I
understand.
And again, I'm going to ask the opposition to just clarify a little bit with respect to that response. But I look at this from the standpoint of, if I get my current notice prior to the enrollment period from my insurer that tells me my new rate is unreasonable, why would I need or want a new enrollment period in order to shop around? Can I just shop around then? Right? But excuse me, I've heard your answer. I would like to have a response from the plans.
No, thank you, Assembly Member. And as the sponsor noted, there are times when the unreasonable determination does happen after open enrollment begins and after the policy year starts. I think it's debatable whether it's due to a lack of responsiveness by one side or the other. I'm not disagreeing necessarily, but I just don't know. But in any case, the amendments that we put forward stated that if the regulator makes a timely determination, that we would include it in our notice. The amendments, I think, attempt to address that issue. The author amendments attempt to address that issue, but still leaves open the question that even if the health plan does comply with requests for information, and the regulator does not make the 60-day or meet the 60-day window, that the provisions of this bill, including what I would call the deterrence provisions of this bill, which is a special enrollment period, would activate. And so if everything was going according to timeline and going to plan, there would be no need for that deterrence provision in terms of the new special enrollment option, so which we believe should be removed from the bill otherwise. So.
Okay. All right.
Yeah.
Did you want to respond? Okay, thank you. I said like we're close. I wish we could get a little closer. Thanks.
Thank you, Assembly Member.
Other questions, comments from the dais? Mr. Lackey.
Yeah, just a broad question here. I guess what I'm trying to figure out is exactly why, when the plans have the MLR requirement, why isn't that enough protection?
The medical loss ratio is based on profits. That's within federal law and state law, but that's profits to the plan. But maybe there's instances where the overall cost of providing that care for a particular product may go up for circumstances outside of the control of the health plan. But the consumer should still know. So they're separate issues. It's profitability of that health plan. That's not what's at stake. It's the overall the cost of the plan to the consumer.
Any other questions, comments? Seeing none, Senator Hernandez, would you like to close?
Mr. Chair, I respectfully ask for an aye vote. Thank you.
Okay, thank you. Madam Secretary? We'll call the roll here in just a second. Thank you. I'm going to call the roll. Yeah, go ahead. Yeah. So we got it? Okay. Entertain a motion. So a motion by Ms. Campos, a second by Mr. McCarty. Madam Secretary, please call the roll. The motion is due pass as amended to appropriations.
Wood?
Aye.
Wood, aye. Mainshine? No. Mainshine, no. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Aye. Campos, aye. Chu? Aye. Chu, aye. Gomez? Hernandez? Lackey? No. Lackey, no. Nazarian? Olson? Patterson? Patterson, no. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? McCarty? Aye. McCarty, aye. Waldron? No. Waldron, no.
Dr. Hernandez, that bill stands at 7-4. We'll leave that open.